Hi, everybody. Welcome. I'm just giving the system a second so that everybody can get into the call. I see the numbers of attendees ticking up, and when that slows down, I will officially start the call. Okay, great. I think we've got a good group to start. So let me again welcome everyone to our call today, sponsored by CLASS, Center for Law and Social Policy and Family Values at Work, outreach to different constituencies. And let me first introduce myself. This is Wendy Chun-Hoon. I'm the co-director at Family Values at Work. And we are a peer network of advocacy coalitions in 27 states that are all working to establish paid family medical leave programs, paid sick and safe day laws, and other policies that value families at work. And let me share with you also, I still see folks who are joining the call, and we're just introducing folks. So on the phone today, we have paid family medical leave administrators, and I think I've captured all the states who have joined today, from Connecticut, Washington, D.C., New Jersey, New York, Washington State, and there may be one or two others. I'm also joined by my colleagues Gail Golden and Marianne Bellasorti here at Family Values at Work, and our colleagues at the Center for Law and Social Policy, Pranitha Gupta, Tanya Goldman, and Eduardo Hernandez. And in a second, or in a couple of minutes actually, I'm going to more formally introduce our guest speakers, who are Eileen Applebaum and Donna Cohen-Ross, and I'm going to come back to you both in just a second. Again, we're just kicking off the call for those of you who are joining just a couple of minutes after I started speaking. We're still introducing. So this is our second in a series of webinars that Family Values at Work and CLASS are hosting since the meeting that we convened with all of you, many of you, last December, on lessons and questions that are stemming from state policy design and implementation of paid family medical leave programs. And the focus for our conversation today is really around outreach. You know, once your state programs are up and running, or also for some of you, how to plan ahead for that moment. So again, welcome. I'm going to quickly share our agenda for today's webinar, and also really just the goals for the conversation, really which are to surface some of your initial questions and concerns as agencies who are administering and implementing paid family medical leave programs about program outreach. You know, and really, what are your roles and goals in program outreach? We're also going to share some lessons that we've learned so far from community outreach pilots that may have some lessons for scaling what we've learned so far. We're hoping to spark some ideas for even greater scale for outreach, and perhaps, you know, more automated ways to sort of target timely outreach to likely eligible FMLI or paid family medical leave populations, using lessons from other public benefits programs. And I really just want to sort of conclude my initial welcome by saying, you know, this conversation is really meant to be generative, really meant to just start to surface some challenges and spark some ideas. And we're going to offer, you know, some lessons we've learned so far, but really want to engage all of you in the conversation. So in that spirit, we're going to actually go to hear from all of you who have joined this webinar. So I'm going to ask Eduardo if you could please help us unmute everybody's line right now, and really so that we can do a round of introductions. And what you see in front of you on the screen are some instructions. Oops. Go back 1 second, Eduardo, if you can. Just some instructions while you're cueing the other way. Eduardo, could you go back one? I just want to make sure everyone knows as we're inviting them into the conversation. Soon, I hope you'll see instructions in front of you on the slide that show you how you can raise your hand to offer something into the conversation, but also there's a function that you should see on your screen where you can type in something into a chat. So there are lots of ways. One, we've unmuted the line, so everyone try to manage your own background noise and keep yourself on mute if you've dialed in on your cell phone or office phone, because we have unmuted the lines. We're coming to you all to hear a little bit from who you are and some of your initial questions. But these are two ways that you see on the screen right now where you can raise your hand and Eduardo will make sure that you're unmuted and or type your question in or chat in. So those are ways you can engage. All right, so now we'll go to the next slide, Eduardo, thanks. So we gave you a little bit of homework, asked you to think ahead about a couple of things. You know, what's a key question that you have, or what's a challenge that you're facing about how to conduct effective outreach to constituencies who are beyond, you know, the initial constituency of employers. And for those of you who are feeling brave, maybe you have an idea that you're mulling in your agency about outreach that you'd like to workshop with folks who are on the call. So we're going to go state by state. And I'm just going to help out with this, I'm going to actually just call on states, and I'll probably go in alphabetical order. When I call your state's name, if you could, anybody who's joining from that state, please introduce yourself and your role. And then if one of you can just share the thought that you prepared about either a key question or a challenge you're facing around outreach, or perhaps an idea you'd like to workshop. So I'm going to go ahead and start with Connecticut. Who's on from Connecticut? Okay, that may mean that they haven't joined. And who's on from Washington, D.C.? I'm just going to double check, Eduardo, if everybody is unmuted.
As far as we can tell, people are unmuted, but if you, when we call your name, can you click on it to tell us you can hear us and raise your hand? Should I name Tanya Thompson from Washington, D.C., are you there? We're trying to see if we're having some technical difficulties. Maybe Wendy, you can see who wants to jump in and just start to see if it's actually working.
Sure.
We've tried to unmute people.
Good. So just anyone who would like to go first, introduce yourself, your name and your role, and what state you're coming from, and a thought you had about outreach.
Okay, try it. Missy Stewart. Missy, are you available? Yes.
Yes, great. I am. Can you hear me?
Yes.
Now we can, yes.
Okay, hi. So my name is Missy Stewart. I'm the Director of Public Information for the New York State Workers' Compensation Board, which is charged with administering New York paid family leave, which just went into effect as of January 1, 2018. And I guess one challenge that I'd like to ask the group, one challenge to do effective outreach is that people who are in a position to use paid family leave are already dealing with so much and probably are doing a lot of red tape or going through a lot of red tape with their healthcare providers and or their issues. And it's not an easy time in their life. So how can we best support employees in accessing their benefits when they're needed without causing, you know, additional stress? So that's one challenge we have.
Thank you, Missy. Thanks for going first. Great. That is a real challenge. Who would like to go next? And Pranitha, that was helpful that you called them folks because I can't see the back end of the system. So if there's a way that facilitates that would be great.
Jill Gutierrez. Jill? Okay, we're just trying to see, if you're ready, can you please raise your hand so we know to call on you, because we're having a hard time seeing if you're unmuted or not. Okay, Jill, we see that you're raising your hand, but we can't hear you. Okay, Allison Elridge?
Yes, this is Allison.
Great.
I can. Great. So this is Allison Eldridge. I'm with the Paid Family and Medical Leave at the Employment Security Department in Washington State, and I'm in the communications for the program. And I think our law is a phased implementation. So right now our primary focus is outreach to employers because they have the first set of deadlines for the program in 2019, and then folks who pay in cannot get the benefit until 2020. So we're sort of, they're very different messages for the employer community versus everyone else. So one of the things we're working on is making sure that we have the right messages and the right messengers for a ton of different populations.
That's perfect.
And we're interested
Allison.
in how other folks are doing that.
Perfect. We're going to get to a lot of that today. That's great. Thank you.
Okay, so we're trying to see. So again, please raise your hand if you are unmuted and ready to go. Anybody else? Because we still see, Tanya Thompson, are you available? Tanya?
Hi, this is Tanya Thompson. Can you hear me?
Yes. Hi.
Hi. This is Tanya Thompson with the Washington, D.C. Office of Paid Family Leave. I am our outreach manager, and because we're in the early stages of implementation for the law, we're really just interested in hearing from other states on what are some effective outreach strategies, how to reach populations that are often hard to reach, and really just taking advice from other states.
That's great, Tanya. So glad you could join this call.
Thank you.
Anyone else?
Okay.
Go ahead.
Oh, yes. We're just trying. Anybody else? We just haven't seen your hand up yet. If you could just... Millie? Millie typed it in because I think she's having difficulty, so I'm going to read it, okay?
Thank you.
Millie Baelish from New Jersey Temporary Disability and Family Leave Insurance. I supervise the Program Services and Quality Assurance Unit that has responsibility for outreach. I would like to know how to reach the underserved areas of our state.
Great. Thank you, Millie. Key question. I might suggest this, Pranitha. That was really helpful just to get a sense of sort of who's on the call. I do know that there are others on who just haven't been able to either speak up yet or unmute. And you could do what Millie did and use the chat function, and Pranitha and Eduardo will help us flag when there's anything in there so that we can raise it for the group. That seemed to work well. Thank you, Millie, for modeling that.
So we have another one from...
Oh, yeah.
We have another one from Jillian Gutierrez. What data should I be... She's also with New Jersey. What data should I be using to make my case about who it is unlikely that we are reaching currently?
Wow. Great. Great segue to introducing Eileen. But we'll get to that in a second. Pranitha, I just want to check and see if anybody else is in the queue.
That is all we have right now, but definitely feel free to send us either to raise your hand if you have any questions or concerns, or just type it in the chat for us.
Awesome. Thank you so much for helping with that. Okay, so we can go to the next slide. I want to introduce, finally, I've maybe done a little build up for this, our speakers today. Eileen Applebaum is co-director of the Center for Economic and Policy Research here in Washington, D.C. She's also a fellow at Rutgers University Center for Women in Work, and she holds a PhD in economics from University of Pennsylvania. The thing that I've been wanting to say about Eileen is that she and her colleague Ruth Milkman did incredible research and wrote then an incredible book called Unfinished Business: Paid Family Leave in California and the Future of United States Work-Family Policy. And really, just to build off of what Jillian just posed as their central question in New Jersey, it was really Eileen and Ruth's research on the early years of the California Paid Family Leave program that has informed a lot of, our collective work in the past couple of years, both on the policy design side and also really driving an imperative on the community side to focus on implementation. I think it is really clear to us that without strong implementations, laws mean nothing. And so to introduce Eileen and what she's going to be talking about, just a little background context, that Family Values at Work and others have been raising some private foundation funding to start to support some pilot outreach level efforts really in the community, and keeping in mind a couple of key design elements that, though the pilots that Eileen is going to tell you about are really based in community, we were really trying to be thoughtful about how do we design them beyond sort of the retail level, and really push for what can be scaled. And the second thing we were really thinking about in the design of these pilots, we're looking for lessons about where access continues to remain a barrier and how to mitigate those barriers by either revising public policy or systems reform or improving systems practice. So Eileen, I'm going to turn this to you in a second. While I have the mic, I'm just going to say that after Eileen's presentation, we want to do two things. We want to really invite all of your questions and reflections on what Eileen's presented, and I want to invite Donna Cohen-Ross, who's our other speaker, into the conversation to share innovations and lessons about large-scale outreach efforts from other public benefits programs like the Earned Income Tax Credit, the Children's Health Insurance Program, and the ACA, because Donna really has, over her professional career, sort of long held this challenge about outreach as a labor of love. And so Donna is currently a vice president at the Center for the Study of Social Policy, where she heads up the center's Young Children and Families team. But she really has devoted her career to reducing poverty and improving access to public benefits through policy advocacy and outreach. She served in the federal government at the Center for Medicaid and CHIP services within HHS, and has worked at many reputable organizations like the Center on Budget. So we're going to hear from Donna after Eileen gives us some of the lessons from these community-based pilots. I'm turning it over to you, Eileen.
Okay, thank you very much, and thanks for that lovely introduction. So what I'm going to do is I'm going to lay out first the problem, which is the lack of awareness. This is in California. Talk a little bit about what they've done there, and then talk a little bit about what we have done in trying to overcome this lack of awareness through these pilots and the lessons that we've learned that we want to share with you. So next slide, please. So the first thing is, this is 2011. The law was passed in 2003. People could begin claiming benefits in 2004, just like one of the other states that is phasing it in that way. And so people have, by the time this survey was done, people have been collecting benefits for 7 years. And still you can see that overall, Less than half of the people know about it. Women a little more likely than men. Whites and Asians more likely than blacks or Latinos, where the knowledge of it, awareness of it is really low. And you can see it by age groups. Let's go to the next slide. We also looked in California at the various counties and discovered that LA County had the least awareness, and so some of the efforts were focused on LA. Unions, you can see, do help people learn about it, but unions are not many people are represented by unions these days. Next slide. And here it is by income. So what you can see is that people with a high school degree or less, people in low-income jobs, people who have less resources are much less likely than other workers to know anything about, or other citizens don't know anything about the fact that they have paid family, and they've had paid medical leave in California since the 1940s. So we were basically focused on the family leave piece of it. So the next slide. And here was the really disappointing thing. So between 2011 and 2014, awareness actually went down. And so this was fairly distressing to everybody. And the advocates were able to work with the department that it's called EDD in California that administers this. They worked together to get the state legislature to allocate funds for improving awareness, and I'll talk a little bit about how those funds were used in a minute. So next slide, please. This is important for the folks who have a time to talk to employers before it's implemented. You can see the main way that people learn about paid family and medical leave is from their employer. And what we found is that employers that have good benefits are the ones most likely to talk to their employees about it, especially because in California, also in New Jersey, I'm not sure about your states, other states, it's possible for employers to coordinate their benefits with the state benefit. So if you are an employer in California who had been giving people full income while they were out, let's say, on maternity leave or paternity leave, you now can have those employees collect the first 55%. It's going up now, but that's what it had been from the state program, and then just top it off at 45% instead of paying the full 100%. So employers that had benefits or that have an HR department inform people about it. The second most important way that people learned about this is from a friend or family member who knew about it and who most likely learned about it from their employer. The other methods of learning about it are really, really low. The outreach by the department itself, social workers, online notifications from the department, these did not really reach very many people. I'm not really going to talk about the next slide. It actually just gives you the numbers in case in the work you do, it would be useful to have them. So just let's look at the next slide. So you can see that this was almost 16,000 people. So it's not a small survey. And it was done online, so it's catching people more likely to know about it than just ordinary people, many of whom might not be either able or willing to do an online survey. So next slide. Okay, now we're going to talk about the lessons from the pilots in the field. Next. Okay, so one of the things that is really important, we found, is partnering with community organizations that have advocated for these various work-family policies. They are feet on the ground, they know their communities, and they're also able to speak with the state legislature. And they were really key in California, getting the state legislature to allocate $5 million over 3 years to EDD, which is the department in California responsible for this. The advocate organizations can really play a lot of roles for you. They can do outreach to service organizations. They can provide the training, which you may not have the time to do, or the staff to do it. They can tailor materials to the particular service provider needs. So you'll see we did some pilots with the WIC Center in New Jersey, with a large clinic in a part of LA that serves a largely Spanish-speaking population, and the messages and the information was tailored. What do people want? Do they want a brochure? Do they want a one-pager? What are you going to put up on the wall? What is going to be most useful to you for the population that you serve? Advocates come from the community, and they are viewed as trusted messengers. When they come and talk to you, you're likely to listen. It's a little different when somebody who works for a government agency. I know how great you folks are, but as you know, the constant there's a constant refrain from this administration saying, these are not people that you want to deal with. And so it's very helpful if you partner with the advocates and they can make the introduction for you. They can go into the community. They know which are the organizations most likely to be able to do the outreach. Agencies should, if there is any money for outreach, should consider regranting some of the outreach funds to the advocates and also to service providers. It was important in some of these cases to free up just a little part of the time of an employee on staff to actually do work that needed to be done to get these messages out. And so freeing up that time for a few months is really a critical step if it's possible to do it. What we discovered is that the agencies, usually in the Department of Labor, do not have experience with regranting. And so I guess it's on the next, I do say it here. You might need to partner with other agencies in your government that do have that experience, because you're going to have to, create memoranda of understanding and specify what is required and how you're going to select the groups that you might want to regrant to. The other thing that turned out to be really useful in California is that the advocates and the agency staff have quarterly meetings in which they discuss progress, they surface problems, and the community organizations can try to help resolve those problems. Another important function is how are you going to provide information to people out there who want to access your programs and have questions. In California, they won't give you any advice. Should I apply for this? Am I going to be eligible? They can't answer that question. They tell you, go through the application procedure and we'll notify you. But people often want more information than that. And so if it's possible there usually is a hotline in some of these, not usually, but there often is a hotline in some of the major communities by a local legal services organization, but they are underfunded to take on the volume of calls they're going to get as the paid family and medical leave programs go into effect. So next slide. So we are going to tell you what worked and what didn't work. We were funded really to go out and do pilots, and the funder said we're going to learn as much from what didn't work to what did work. And so we had 2 projects that were really at the retail level. What about home child care providers? In New Jersey, in this particular part of New Jersey, they are unionized. And so it was not going out and meeting them one at a time. It was meeting them, coming to their union meeting and doing educational, preparing an educational program around paid family and medical leave. But it really did not work. It was that they had too few parents in any of these home child care providers to really be able to reach very many people, and this was very time intensive. And the same thing, another idea was, well, we have a major retail corridor here. How about if we just take somebody on our staff and send them out to go door to door to these employers, because it's the small employers who don't know enough about the law themselves to even let their employees know that yes, you're having an event that makes you eligible for either paid family or paid medical leave. So how about if we inform these employers? And again, it turned out to be extremely time intensive. It couldn't be sustained once we didn't have funding for paying somebody to actually go out door to door. And there was no way to spread this to other providers or employers. So those kinds of things we quickly found out did not really serve the purpose that we had hoped that they would serve. Next slide. Here's another example of something that didn't work. So, okay, small is not going to work. Is big the answer? And so this was a very big organization, and it was enrolling people in the Affordable Care Act into the insurance exchanges. So lots and lots of people. And so, yes, this pilot reached hundreds of people with information about the paid family and medical leave in New Jersey. This was, but it turns out that this is not a key part of the mission of an organization that does Affordable Care Act enrollment. And there was no way to really build this into the regular routine of this Affordable Care Act organization. And again, when our small grant to the organization ran out, they could not sustain it. So we did do regranting, as you can see, to make sure that both the advocates and the service providers had some funding to get these things off the ground. And then the idea is they're to be built into your routines and be sustained without the necessity of special funding. But at the Affordable Care Act Enrollment Organization, that was not possible. So next slide. Okay, now what is it that did work? And I'm going to give you two examples of things that worked. And this was a WIC center in New Jersey that served mostly low income, mostly Black households and families, including, of course, workers. And this group, as we knew, was least likely to know about the paid family and medical leave and most likely to need it. And initially, the WIC workers were skeptical. They put up with it because the person who came and talked to them was a trusted messenger, came from an organization in the community, and had some standing to be able to speak to the director at the WIC Center, some of the workers at the WIC Center. But it took a little while, but this WIC Center, its main mission is to help mothers produce more milk. And you can talk about all the other things that WIC does, but these folks were focused with a laser, like a laser beam, on new mothers producing more milk. And once we talked to them about how being able to get paid family leave would reduce their stress level, and that their partners could get paid family leave, which might help in other ways to reduce stress, they were going to be able to produce a lot more milk. And the minute that message got across, these folks, they wanted to do this. And so the advocacy group trained the staff in the basics of the FMLI, how to help clients get more information if necessary, how to apply for it. And the center had that WIC Center had very specific ideas about what they wanted in a poster, what they wanted in the handouts, what is going to be useful for the people that they are talking to. And this is now, that pilot is long over. They still call on the advocate who met with them when they have a question. They're happy to meet with people. They have public meetings that the WIC has public meetings on a variety of questions. They will always have somebody speak about paid family and medical leave, and they are taking this message to their statewide, the leadership here is taking the message to the statewide WIC meetings that they have statewide and trying to encourage other centers to do the same that they have done. So we view this as a very successful program, and it might be that it could be done top down and not just bottom up, that it would be possible for your agencies to partner with the WIC agency in your state and say, how do we get this message out to the folks that your centers are serving? So next slide. This was another super, super successful intervention. Clinica Romero in California is a very large clinic. It serves hundreds of people every month, thousands of people over the course of a year, and it mainly serves low-income Spanish-speaking people. And again, this is a community that really is not aware of the FMLI, but needs the benefit. And of course, the clinic staff understood the importance, but they were reluctant to take on new tasks. As we can all understand, it seemed to them like this was going to be a big workload. And the exception was the promotoros, which is what they call the community health workers. So the advocacy organization began by training the promotoros. They took the message into the community. And also, this was a situation where we actually funded somebody to go into the centers and to talk to clients and to talk to staff and bring them up to speed on this. And once it became really clear, you're serving people who need time off to take it. They have come here with a sick family member, and they don't know how they are going to take care of the sick child or their sick spouse or the sick parent. How are they going to do that? They can't take off from work. How does this work? And once it became clear that this was going to improve health outcomes for their patient population, the resistance to taking on the task went way down, and it became routinized. There's now a tab. The person who does the intake now has it. They have many tabs, and one of the tabs takes them to a page that says, do you know anything about the FMLI? Do you know? It has a list of questions for them, and it has handouts that they can give out and information on how to apply. And so this has now become part of the routine. It doesn't take any longer than any other part of the routine. It's just a few minutes more time to bring people up to speed on this and to send them off with information about how to get more information. And once it was successful at this clinic, then another very large clinic in South LA is now implementing the same kind of intervention. So we think of this also as a huge success, and it might be possible to work with the Department of Health to think about ways that you can use this as a means of reaching hard-to-reach populations. Next slide. So in Rhode Island, they did something different. They noticed that there was a high rate of rejections of non-birth parents. They identified two problems. One is that the agency that approves the FMLI benefit only accepted birth certificate as proof the baby had been born. And it took longer to get a birth certificate than the window they held open for applying. So naturally, you're not going to have the right documentation. And so that changed. They now accept a variety of documentation, including a note from the doctor, yes, this baby was born. And the second thing is that the script they read to new mothers when you called about this did not include the fact that the non-birth parent could also get paid family leave. And so they've changed the script. But the lesson from this is it's really important to look at what actually is your agency telling people? What are your eligibility requirements? Are they reasonable in light of whatever other agencies might be doing? And do you need to think more carefully about what's in the outreach that you yourself are doing? Next slide. So what are the lessons that we took from this? That it's important to engage other state agencies. They may have experience granting funds, which you may not have. They may know how to reach service providers in ways that you don't think of. And there's also the question, which Donna is going to discuss, about categorical eligibility. If you just had a baby, should you have to apply for paid family leave, or should you be automatically enrolled with an option to opt out if you don't want to? If you're going right back to work, you don't want to take a paid family leave. And of course, things like cooperating with appropriate agencies to establish eligibility criteria. And one of the big problems that we had and that we do not understand, So maybe folks on this call will understand it. It came up in 3 different states. It seemed to us that when you meet with that social worker after you've been in the hospital, either to have a baby or for your own medical condition or for the medical condition of a spouse or a parent, why can we would have thought it would be natural for the social worker or the nurse that's giving you your discharge instructions to include a handout that says, you're eligible for paid family leave. Here's how you apply for it. Here's some information about it. Here's the number you can call to get more information. And in each of these states, we were told it's not possible to do that. So we don't know what the barrier is. We don't know why it wasn't possible, and we don't know how to overcome it. But if folks on this phone call could figure that out, we would be eternally grateful. Plus, you could do a good deed. And then you can see working with WIC. The other thing is the Department of Labor does have enforcement powers, and you might want to think about the department that manages the paid family and medical leave might want to think about talking to the folks who do enforcement to see what would be a good way to help employers understand that they really have a legal obligation to let people know about this and help them enable them to apply. Next. And so I'll finish up with our key takeaways, which you've already heard me say. Partner with advocacy organizations and be prepared to share part of your funding with them if you have funding for outreach. Partner with state agencies, those that the Paid Family and Medical Leave Insurance Program helps them accomplish their mission. If it's not going to be part of the organizations and agencies are mission driven, and if this will not be part of their mission, it doesn't matter how much you talk to them, it's not going to really help. And encourage the advocates to focus their outreach efforts on provider organizations that are large, that can provide a template for taking outreach to scale, and for whom paid family and medical leave is key to fulfilling their mission. So I'll stop here and happy to take questions.
Thank you so much, Eileen.
Thanks.
That was great. That was also a lot. So what I want to do now is we have really purposefully saved, at least a half an hour or more for this next part of the conversation. And I want to invite, I know earlier it was a little bit of a barrier to hear people just speak up. So class friends, I'm going to call on you to cue us if you see people in the queue. But really want to just invite some conversation here. What did you hear in Eileen's presentation that was interesting? Where do you want to probe a little bit more? And then Donna, I want to encourage you to bring in the expertise that you've built over your years and experience in working with other public benefits programs to just probe this question about, how do we do scaled and effective outreach well? Is there anyone that wants to jump in with a quick question or reaction on Eileen's presentation?
So this is Donna. Thank you so much, Wendy, and special thank you, Eileen. I think you hit all the highlights, and what is so inspiring to me is that these are kind of universal truths in the world of outreach in terms of what we need to be thinking about, no matter what it is that we want to happen with respect to making sure people know about benefits that could be very, very important to them. And I did have some specific thoughts on some of the big takeaways that Eileen laid out for us. And Wendy, what is the best way?
Yeah.
Should I
please.
kind of dive in with just some thinking?
Yes.
Or,
yes.
Great. I'm happy to do that. And let me just say, as Wendy mentioned, I've spent a long time over many years working in the area of how do we make sure that people who are eligible for public benefits know about them and also know how to claim them, whether it's been the earned income tax credit, which many of you may be familiar with, and also health insurance of various types. And I've also had the great privilege of working in a number of the states that are represented here. And I mention that because one of Eileen's takeaways, which, you know, kind of encourages us to partner with our sister agencies, our counterparts in other agencies, is really very key here. When I think about New Jersey and California, I think about some of the most innovative and successful outreach, both on children's health insurance and also earned income tax credit. So, you know, at an appropriate time, perhaps offline, I'm happy to talk about who those people are that have such rich experience that I think the folks on the call might want to make friends if you don't already know some of them, and I'm happy to help facilitate if that's helpful. I want to just point out the aligned interests. Big takeaway couldn't be more important, and I just absolutely love the WIC example that Eileen put forward. And the way I sometimes frame this aligned interest is a little bit different, and I think about some of the work that I'm doing now in terms of making connections between early childhood and the healthcare system. And I tell people all the time, think less about what your interests are and think about the problem that the group that you're trying to bring on board or persuade to help you. Think about what their problem is and how you can help them. And in Eileen's example, it was that WIC is not only, but very strongly focused on promoting breastfeeding. And so when you go to WIC and you say, if you work with us, this is going to help you meet your goals, very, very powerful offer and message. And I would say there are other ways to think about engaging the healthcare system, particularly in states that are primarily healthcare is delivered through managed care and Medicaid managed care. Those managed care organizations, whether they are kind of commercial plans or, you know, working with under contract with your state Medicaid agency, have performance measures that, you know, that they have to meet, and the payment that they get may also depend on how well they meet them, and to think about what some of those things are. For example, the managed care plan may have may want to improve the percentage of children that are coming in on time for well child visits. Eileen gave us a great example in her California example about how paid family leave helps not just families bring their children in for well child visits, but that's also going to potentially help the managed care plan in meeting its performance goal. Very, very strong interests developing around the country related to identifying and addressing maternal depression. Very, very strong interest in this, to the extent that there's a performance measure around that issue, and you have a message that says, you know, with paid family leave, we can be helpful to you in meeting that performance indicator. That could be very powerful as well. In addition, Medicaid managed care, actually all managed care organizations, but particularly Medicaid managed care, have to do what are called performance improvement projects. And these are kind of, I mean, they get to sound like research projects a little bit, but really what they are continuous quality improvement projects. And sometimes the managed care organization thinks up topics that they would like to address through these performance improvement projects. But sometimes the state Medicaid agency says, all of our managed care plans will work on a performance improvement project together. And one of the things that I just put out for consideration is, you know, is there a performance improvement project goal that you could be helpful to the managed care organizations in your state or in your community or in a community that would include a partnership with you, and thinking about that is important. The idea of trusted messengers and the right message, I think you're all, you know, it sounded like there are a lot of communications folks on the call, and that is really very, very important. But also thinking about how the policy drives the message or the approach to the message, I think would also be very helpful. I thought it was really interesting that Eileen talked about how, you know, when people are going to a navigator to help signing up for Affordable Care Act coverage, it's not really the time perhaps to talk about this because, you know, there's a lot to do in, you know, in completing that application. And we found that as well in work that we've done over many years. We thought, well, it's the same population. Let's talk about earned income credit at the same time we're talking about signing up for health coverage. And that is a recipe for making people's heads explode, right? Because they came prepared and equipped to do one really in-depth thing, and talking about something else in great depth at the same time is, you know, can be very tricky. So sometimes it's, you know, reading information and offering people the opportunity to get back to a trusted messenger later is important. But the other thing I wanted to mention, and this goes to kind of policy driving the message and the messenger, in the Medicaid program, most states have what is called presumptive eligibility for pregnant women. In other words, a pregnant woman who wants to sign up for Medicaid, and the income eligibility for pregnant women is much more generous than you might think. Could be, you know, I think the median for states is 185% of the poverty line. It could be even higher, into the 200s. So it's definitely people who are either working or someone in their family is working. And for presumptive eligibility, a person doesn't have to fill out a whole application. They give basic information about themselves. And if they appear to be eligible, they can be signed up for Medicaid right away and have the rest of the application process happen a little bit later. The whole idea about this was a pregnant woman really can't wait for coverage and prenatal care. And it seems to me that this might be a very specific time to talk about paid family leave because it's very focused on pregnant women. And it also raised another issue that Eileen mentioned, and that was the issue about people want to know, is it worth it to go through the whole process? You know, do I seem eligible? And the answer, well, apply and find out, might not be so satisfying. And what presumptive eligibility does is it gives people the sense that, yes, this is worth any trouble that you might perceive it to be, because at the end, you know, we feel very, very confident that you're going to qualify. And so perhaps the same message about paid family leave could be interrelated there. Also, when you think about this, I guess the last thing I want to say is the issue about you know, a wholesale approach versus a retail approach. I can't underscore how important that is, just in efficiency, but also cutting the red tape. One of the folks on the phone, I think the very first thing she said was like, how do we get around this red tape? And I think that's really important. One of the experiences I had, and I was sharing this with Wendy, was actually in New Jersey more years ago than I'd like to recount. And we were focused on getting information out to people about the earned income credit, which was something at the time most people hadn't ever even heard of. And we went to the agency that, the Human Services Agency that was focused on childcare, on other cash assistance for low-income, families with low income. And we asked if they could this is when everything was done through the, what we call snail mail now, may still be some places, and they said, yes, if you want to, we agree, this is an important message. Your mailing, it has to be these dimensions so that our mechanized systems for stuffing envelopes can handle the piece of paper. It can't, the paper has to be such and such a weight because it can increase the postage. And we have a rule in our state that anything we send out has to be in the following 3 languages. Whatever it is, there were specifications. And if we could meet the specifications, they were only too happy to share our message broadly and widely. And so it was a lesson on, again, partnership that was of mutual benefit, but you have to help the other person meet their needs if they're going to help you meet yours. And then just finally, this issue that I think was called kind of categorical eligibility, which in Medicaid and CHIP, there obviously is, or there was anyway, categorical eligibility, but we also work a lot on designing policies that would put people, quote, on the express lane to coverage. And the idea was that if you could use information already available to the agency or to some government agency to help facilitate or jumpstart enrollment, that would be helpful to families, to individuals who might be eligible, and also save all kinds of administrative costs in the system. And this did take legislation and regulation, regulatory treatment of the problem. But just to give you a sense, in Louisiana, which picked up on these issues that would be helpful once they enacted their Medicaid expansion, what they were able to do is take knowing that most people who were receiving food assistance benefits through SNAP were also going to be eligible for Medicaid. The agency could use that information, and there were certain other stipulations that they had to comply with, which were not difficult, but they had to do it. But the long story short is that on the front end, the agency did almost all the work in making sure that people participating in the SNAP program could easily get enrolled in Medicaid. And the day that the Medicaid expansion began in Louisiana, they metaphorically flipped a switch, and the next day, hundreds of thousands of eligible people were enrolled. And over the course of time, it was close to 1 million eligible people got enrolled through this connection with SNAP. And that was just one state. So there may not be something exactly analogous with paid family leave, but it would be worth exploring with other state agencies that are interacting with the same folks that you are caring about and seeing where the connections could be made. I am going to stop there and hope that some of the wheels might be turning for you based on some of the experience that I've shared.
This is great, Donna. Thank you so much. Also, you gave such a range of different ideas that probably does have people's wheels turning. Please, anyone, just either raise your hand or shout out anything that intrigues you. And in the absence of hearing anyone, I'm gonna fill the space because I have 5 things that I think might connect at this point. So just speak up or clasp friends. Please cue me. I saw a comment that I think came maybe, Allison, from you in Washington. I just want to respond quickly, or invite you to jump in to ask it. The idea was about training social workers. So I'm not going to, I don't have enough detail to sort of spell that out anymore. So please jump in if you'd like. But I will say that idea, you're sort of wondering. Oh, go ahead. Are you jumping in?
Allison's ready. Sorry, Allison's ready.
Okay, go.
Hi. Sorry, this is Allison, Washington. So we're not quite there yet because we're still, we don't have benefits available till 2020, and we're working with mostly an employer audience, but we did start sort of reaching out to figure out how social workers in our state are organized, whether there were networks of them that we might be able to tap into to get them more involved in disseminating the information for us. And I have a lot of social workers in my family, and they suggested that most social workers stay fairly well connected to the people that they were in a master's program with, that they form like really tight bonds, and that if you can tap into sort of the educational networks and like go into current social work classrooms and master's programs and do a presentation about a paid family and medical leave program, that those people then would graduate and carry that message forward for you, and sort of try to spread it once they graduate.
I love that idea, and I invite anyone who has a specific response. I will tell you that I've both with colleagues in Rhode Island and just on whim about how to do outreach. It was about Maryland's paid sick and safe days law, not paid family medical leave law. But in both of those examples, we've had pretty deep conversations about how to reach those networks of like direct service providers. So you're highlighting one type of, a social worker, but those and other direct service providers, including, or I should say, through continuing education sort of credit idea, where folks are looking for curriculum. And this was something that we had tried. I can't recall what stage this work is in right now, but we had tried in Rhode Island, where you're going in and giving a presentation to an audience that needs continuing education credits, and they have direct contact with the, largely likely eligible population for paid family medical leave. So I think that's a great idea. I also think what you just raised is a really kind of unique way of approaching the challenge, which is, who are the social networks of the folks that you think could be good messengers, and how are they organized, or how do they organize themselves? I thought that was really like a creative way of approaching the question. Do jump in. I want to react to a couple of other things to maybe draw out some other ideas.
So,
yes.
Wendy, this is Donna again. I have a different reason for loving that idea. And that is, again, based on, experience with pediatricians. When you are able to embed in training new professionals, whatever the idea is, in this case, talking to potential participants of paid family leave, when that's embedded in training, it becomes an expectation that a competent person coming out of that training program will do this. The example that I have is an early literacy program that I work with, where pediatricians use books in the classroom as developmental surveillance tools. And, one pediatrician said recently, I was trained this way, and when I walked into the first clinic that I worked in after medical school, I had my stethoscope and I looked around and I said, where are the books? And it's because that was the expectation. And so build the expectation, for the future.
That's great. There were a couple of questions in the beginning, and I think they were maybe Jillian and Millie from New Jersey, that raised something that I just wanted to come back to. And the question, I think, I'm putting two questions together about how do you reach the hard to reach, but also how do you know who is and target the hard to reach with what data we have available. And I just want to, Eileen or Donna, if you have any other comments, please add them. But the two things that stood out for me in listening to Eileen's and knowing how we tried to design those community outreach pilots, the one in Rhode Island, they really looked at what is the data showing us about rejection rates, and the level for non-birth parents, the rejection rate for non-birth parents or second parents was twice as high. And so they started going in with a data question and looking at the data and saying, could we turn the curve on that? And they designed the entire pilot around it, which then led to a systems change, really simply. And then the other thing about research, Eileen, maybe this is a question for you. This maybe goes more directly to Jill's question. When you did the California survey, you came up, the evidence showed that it was really young families. It was young families in key geographies. It was low-wage workers. It was folks in the Latinx and African American community. Looking at, so is there anything that you might share with New Jersey about either, those data sources or even how expensive that kind of surveying was as you were doing it? And is it, what's a transferable lesson to anyone who's sort of looking to look into their data or similar data sets in their state and try to glean, okay, this is the highest, that will have the highest impact if we focus on this population. It is how we designed the California pilot, and it's why we went into large federally qualified healthcare centers serving these communities in East LA. Go ahead, Eileen.
Yeah, so just to say, it shows up all the time as it's less educated workers, low-income workers whose employers are not likely to inform them. So the groups that are working with employers, really important to reach. These small employers paying low wages who themselves don't know what the law entails, even if they want to do the right thing. But it's pretty clear what the groups are: low income, low education, English is not your first language, as you said, Latinx and African American populations. That is where the greatest need is. In terms of what it costs to get those surveys done, what we did is we glommed onto existing surveys. So if there's a survey in your state that's done by, in New Jersey, the Blasting Center often does workforce surveys. It costs roughly $2,000 to add a question. So for $10,000, you can add 5 questions. And if they're well designed, they will get you all the information that you're looking for. And the surveys will already have the employment data, the age data, the gender, the race ethnicity questions, income sometimes, county. And so if you can glom onto that kind of a survey, the other kind of survey, which may be even cheaper, but we'll get to likely voters or to registered voters, are all the polls that are going on right this minute about who are you likely to vote for and so on. But they often have at least some basic employment questions. Do you work? Income category, race, gender, political preference. So there'll be a lot of questions already there that you can use, and you add a few of your own. They may or may not have, they might have county data. So it's just good to think about who's doing those polls anyway, and ask them what they would charge to add it, how much do they charge per add a question.
Thanks, Eileen. And just picking up on Missy, the question that you had asked in the beginning about, it's really how do you get the right information of folks at the moment they're having that qualifying event. And so I think that's one to just keep rolling around in your discussions in your state. And I really, if anyone can unlock this big hospital systems and how we get information of people right at that moment of discharge, that would be great. The other one I want to raise up and then turn it over, Eileen and Donna, to you for any last sort of provocative thought or example, or anyone who wants to raise one last question goes, Allison, to you. You really raised the question about who are the right messengers and what is the right message. And I can't underscore enough, like, this whole notion of, health and health centers as a hub in the community, a physical hub in the community, and a presence. And also the way in which folks who might be eligible come to a health provider is already a trusting relationship. And the extra bonus in the California pilots was really this key pivotal player, which in the Latinx community is a promotora, like a health promoter, somebody who is actively working their networks in the community and it sort of sees themselves as an organizer to connect the dots between, oh, you're in here, we're having a health conversation, I'm a trusted messenger to you. Let me tell you about this thing that you ought to know about, that you ought to be able to use and access. So just, again, that right messenger, right message, trusted messenger. So Eileen and Donna, any last thoughts or examples you want to throw out?
Well, this is Donna. I would just piggyback on what Wendy has just said. And, what makes someone a trusted messenger? In the example of the promotoras, and there are a lot, and in the example that Eileen talked about earlier, where she encouraged us all to continue working with advocacy groups. In my experience, the people who are the trusted messengers are often the people who are from the community that we want to reach. And sometimes, there'll be really surprising things that someone from the community will know about the community and how to get messages out that you would never think was true. I was relating a story to Wendy and Eileen earlier about an experience long ago where in a community on the coast, they said, well, we're going to do outreach at the campgrounds in the summer. And I thought, well, why would you do that? The tourists are at the campgrounds. And what I didn't know and then felt kind of sheepish about afterwards is that the answer was, well, no, during the summertime, the rents go up so high that people who are renting properties during the year go to campgrounds for the summer. And the, quote, summer people who can pay the higher rents rent out the expensive housing on the beach. And that turned out to be a really fruitful channel for conducting outreach. And again, I would not have known that and needed to trust the people who live there to get the message out in the most effective way. And I just think you'd be surprised about what you don't know. And the other, the piece about thinking about sharing resources you have and figuring out what you have to do to re-grant some money to some local groups to get that message out is another really, important connection there. So thank you for that.
Thanks, Donna. Eileen, any last thoughts?
No, I think we've covered everything. I'll just mention one thing, and that is that the EDD in California has made fabulous public service announcements that can be run as ads. I've seen some of them. They're poignant, they're touching, they get to all of the various people who might not think this applies to them. I don't know what would be involved in being able to also use those. What is there a licensing fee or agreement or something? But if you're planning to do that kind of outreach, you might reach out to them first.
He and Eileen, I asked him directly. This is Director Henning of EDD in California. He is really interested in making those available. I think it's a very simple ask, which we could help with. He was just going to check whether they were proprietary to the EDD and could share them. He's very interested in sharing them so that maybe that work doesn't have to be paid for and redone by other states. So that's a good follow-up item. And I just want to help close us out by really appreciating Eileen for all the foundational research you've done to help us direct our efforts better, and really for really helpfully evaluating the community-based pilots that we were able to invest in to reach, hard to reach communities and to identify who those trusted messengers are and some of the early lessons. And then Donna, to you for your years of sort of experimenting and innovating on the outreach and your constant push that we really think more about scale and how to scale what's working. And then to all of you as the folks responsible for implementing these programs within the agencies, genuinely for your interest and also for the role that we feel like you most effectively play in this partnership about how you reach, large-scale systems, large-scale information, big-scale providers that community folks we can't quite reach, and just the thinking that you're going to provide to that area. And Donna, appreciate also your connection, your offer to everybody that you would help to connect folks that who have done this work in the past in a couple of the states, and also just, continuing to call on Eileen and Donna for other ideas you may have. That's great. And to help manage your inbox, there's two things that I would invite. There's a survey that will immediately follow this. You'll be prompted to take a survey, everybody who's participating. Just give us your feedback. It'd be really helpful, especially places where you'd like to follow up. And please do reach out to any one of us, myself, Wendy, or Pranita, or Gail, emails you see here so that we can collect all that, any questions you have, and engage Donna and Eileen as we go. So thanks, everybody, for joining. This was really rich and very helpful. Appreciate everybody's participation. And we'll make sure you get slides.
Okay, well, thank you
so much.
Thanks for having me.
Thanks, everyone.
Okay, bye-bye.
Okay, I'm